Hi, I'm Dr. Pavan K Addala, Senior Consultant, Surgical Gastroenterology, Yashoda Hospitals, Hyderabad. Today we'll try to understand what is hernia. Hernia is basically any defect in the muscle or in the connective tissue of the abdominal wall where your intestines or the fat inside the abdomen might project outside. This is called a hernia. And most of the times something called omentum will project into it, and sometimes even the intestines can project into it. So they are called the contents of the hernia. So it's common in males congenitally because of the descent of the testis from the intra-abdominal location into the scrotum during childbirth. It's not so common in females, particularly the inguinal hernias, but whereas post-surgery hernias are very common in females because most of the females will undergo a cesarean section or some other kind of surgery during their reproductive age group. Hernias are basically caused by defect in the connective tissue. Connective tissue is basically the glue or stitch kind of tissue which will keep different layers of the abdomen together. So when there is a defect in this connective tissue, that will cause a weakness in the abdominal wall leading to hernia formation. There are different types of hernias. The most common hernia that we see in children is a congenital hernia. As I told earlier, because of the descent of the testis from the abdomen and into the scrotum, that will create a natural weakness point. So through that weakness point, hernia might happen. Whereas in adults, it can be because of the previous surgery, which is more common, and it can also be due to congenital inguinal hernias. As we get older, the tissues will become weaker because turnover rate of the connective tissue will decrease as we age. So the tissue will become much weaker, and the chances of hernia formation is higher as we grow old. It's also common in people who tend to lift heavy weights without proper guidance, and there is a myth that it is common in patients with obesity. Now, obesity might add a little bit of risk, but it's not cause for hernia formation. But we always advise the patient to lose weight as much as possible if they are obese before surgery, because the results will improve when the patient is of lean weight or a thin build compared to obese patients. So all the obese patients are advised to have some weight loss before undergoing surgery. See, all hernias, because they are mechanical defects, they have to be corrected mechanically. So there are no medications for hernia. So all the patients with hernia have to undergo surgery. Because we cannot predict when these hernias can get complicated, it is a standard practice that hernias are operated at the time of diagnosis or as soon as possible after the diagnosis. So it can be approached by open surgical methods or laparoscopically or robotically. At Yashoda, we do a routine laparoscopic surgery unless and until the patient is not fit for laparoscopy, and that is the time when we advise the patient to undergo open surgery.
Like, comment, and subscribe for more health updates.